Our next speaker, Councilwoman Nirva LaFortune. Councilwoman LaFortune is a Providence City Council member representing the city's 3rd Ward and is the first Haitian American to hold elected office in the state of Rhode Island. Since joining the council following a special election in August 2017, Councilwoman LaFortune has served as a vice chair of the Special Committee on Education during the last term. She serves on the board of directors of the Sophia Academy and the We the Village, as well as serving on the advisory committees for the Eastside YMCA and the Eastside Community Alliance. Councilwoman LaFortune is the Assistant Director of the Scholars Programs and Diversity Initiatives in the Office of the Dean of the College at Brown University.
Thank you so much, and thank you to everyone who's here today, Senator Whitehouse, Treasurer Magaziner, Rep. Tansey, Hillary Q, everyone, all the speakers who are here supporting this initiative. As I was driving in today, I thought to myself how privileged I am. I was running late because I had a doctor's appointment. I forgot to schedule my annual around my birthday, which I do every year, and I called my doctor about something, and she's like, you know, you forgot to schedule your annual. And because she came back from maternity leave, they told me, well, they don't have anything until August. They're going into the summer. And I said, well, I need something right away. And I was put on a emergency, cancellation list, and I was able to get my appointment. Prior to my appointment, and I'll share, I was having issues because we should talk about these things. I was having issues, and I got a breast ultrasound, and by the time I got here, I knew that I was okay. And so, which is a reminder of the privilege that I have, that I'm able to access high quality healthcare. I'm able to access the resources. I'm able to access doctors who will tell me that I am okay before I even get home. So that access should be accessible to all people. And that is one of the major issues that we have globally, but we also have here in the United States. So across the board, women of color face a significant amount of systemic, racial, gender-based discrimination. This inequity impacts areas ranging from employment, income, education, and healthcare, creating challenges that further widen the disparity gap and limit women of color from achieving overall success. In the United States, Black, Latinx, and immigrant women face unique challenges that increase their risk for developing preventable health conditions and access to affordable and high-quality care. The health statistics are even more glaring for Black women, who are disproportionately affected by many health factors. They are twice as likely to be diagnosed with diabetes compared to their white counterparts, 40% more likely to die from breast cancer than white women, and more likely to be diagnosed with breast cancer younger, at a more progressive stage, and with more aggressive forms of the disease, limiting treatment options and survival rates. And studies have shown that economic inequalities play a significant role in Black women's health. Compared with US-born women, immigrant women face significant challenges in obtaining comprehensive and affordable health care, particularly sexual and reproductive health services. These structural barriers to obtaining such coverage and care based solely on immigration status impede their ability to obtain basic care for their health or overall well-being, and has a profound impact on economic and personal stability. Although we have made significant strides in improving healthcare throughout the country, Black and immigrant women are still at risk for poor health and economic outcomes. Our communities must start thinking about how racial and economic inequalities intersects with health inequality, particularly for Black and immigrant women. I recently took a look at the Opportunity Atlas, which is a tool that traces the roots of social and economic outcomes to childhood neighborhoods. Basically, a tool that links social and economic mobility among American adults to neighborhoods in which they grew up. And Hillary's husband is one of the people who created that tool. I took a look at the economic outcomes for all neighborhoods in Providence for Black women who grew up in high, middle, or low-income communities. The projected household income is $28,000 per year, which is problematic. Whereas it is $51,000 for white women. For Latinx women, it is $40,000. Asian women, $65,000, and for American Indian or Native American women, it is $28,000. If research highlights the correlation between socioeconomic and health outcomes, Black and also Native American women are at a higher disadvantage, and all women who grow up in poor neighborhoods are at higher risk for lower economic outcomes in adulthood, which can also lead to lower health outcomes. All of these inequities serve as barriers that limit women's access to quality health care, which obstructs their ability to be successful. Women of color deserve equitable wages. Women of color deserve access to various healthcare options and choice. Women of color deserve to be heard, and when we say something is wrong, healthcare providers should listen. Women of color deserve positive relationships with their healthcare provider. Women of color deserve access to health resources that empower them, such as resources in languages that they understand, translators, healthcare providers that reflect their race, gender, or ethnic identity, healthcare services that are accessible, and leaders and community members that will advocate for their well-being. We have to continue to advocate for systemic policy reform for Black, Latinx, immigrant, Native, and overall all women of colors. Because if our women are not cared for, our families and communities will suffer. We need action, and we need policy makers who are willing to take the strides to create legislation that protects and provides access to health care for all women, regardless of their socioeconomic background, regardless of their race, regardless of their gender, regardless of their ethnicity. And I am proud to say that it is happening here in Rhode Island. We just introduced a doula bill. And yesterday evening, the passage of the Reproductive Act bill in the House, which was quite successful, and hopefully that is successful also in the Senate. But we cannot stop there. We need to continue to advocate for policies that will bridge the gap between women of color and underserved communities and the healthcare system. Until we no longer see Black or immigrant women going into the hospital to deliver a baby and never coming home, or in their 30s or 40s dying of stage 2 cancer because they did not receive proper care, or women dying from preventable conditions like diabetes, pneumonia, the flu, or preeclampsia, or women giving birth to children that are malnourished because of a lack of prenatal treatment, or going through a traumatic birthing experience because they did not have access to a doula or any type of resource during childbirth. We cannot stop. Access to high-quality healthcare, regardless of race, gender, immigration status, ethnicity, ability or disability, socioeconomic background, should not be a privilege. It is a right. And until that is accessible to all people, we cannot stop, particularly for women. Thank you.